Quick review: osteology upper limb, scapula, dorsal surface and costal surface. Dorsal surface, spine of scapula, superior angle, inferior angle, glenoid margin, acromion process, coracoid process. Here is suprascapular notch, supraspinous fossa and infraspinous fossa. Costal surface, here is subscapular fossa, superior angle, inferior angle, and this is medial border, here is lateral border. The margin of glenoid cavity, and here is the neck of the scapula. Suprascapular notch, this is coracoid process, and here is acromion process. So the costal surface of scapula and dorsal surface of scapula. Muscle attachment, scapula. The multipinate subscapularis muscle arises from the medial 2/3 of the subscapular fossa. This is costal surface. On the dorsal surface, here is supraspinatus. Supraspinatus arises from the medial 2/3 of the supraspinous fossa, including the upper surface of the spine. The infraspinatus arises from the medial 2/3 of the infraspinous fossa, including the lower surface of the spine. Deltoid arises from the lower border. Here is deltoid. Deltoid arises from the lower border of the crest of the spine, from the lateral border of the acromion. Here is the lateral border of acromion. The acromion fibers are multipinnate. The trapezius is inserted into the upper border of the crest of the spine. Here is upper border of crest of the spine. Trapezius is inserted into the upper border of the crest of the spine and into the medial border of the acromion. The serratus anterior is inserted along the medial border of the costal surface. Okay, on the costal surface, the medial border. Here is, this is the medial border, costal surface. Serratus anterior, one digitation from the superior angle to the root of the neck. Okay, 2 digitations to the medial border and 5 digitations to the inferior angle. So total 8 digitations of serratus anterior on the medial border, costal surface. Long head of the biceps brachii arises from the supraglenoid tubercle. Okay, here is the supraglenoid tubercle. Here is supraglenoid tubercle, here is infraglenoid tubercle. So the long head of the biceps brachii arises from the supraglenoid tubercle and short head from the lateral part of the tip of the coracoid process. This is the tip of the coracoid process. So short head on the coracoid process and long head on the supraglenoid tubercle. Now the coracobrachialis arises from the medial part of the tip of the coracoid process. Coracobrachialis is here on the tip of the coracoid process but on the medial part. The pectoralis minor is inserted into the medial border and superior surface of the coracoid process. Here is pectoralis minor. Pectoralis minor, rhomboideus minor is inserted into the medial border, dorsal aspect opposite the root of the spine. Rhomboideus minor. Rhomboideus major. Rhomboideus major is inserted into the medial border of the dorsal aspect between the root of the spine, from root of the spine to inferior angle. Rhomboideus major. The inferior belly of omohyoid. Here is inferior belly of omohyoid, arises from the upper border near the suprascapular notch. The margin of the glenoid cavity gives attachment to the capsule of the shoulder joint and to the glenoid labrum. The margin of the facet on the medial aspect of the acromion, gives attachment to the capsule of acromioclavicular joint. The coracoacromial ligament is attached to the lateral border of the coracoid process, from lateral border of coracoid process to medial border of acromion process. Here is coracoacromial ligament. The coracohumeral ligament is attached to the root of the coracoid process. from the root of the coracoid process, coracohumeral ligament. Coracoclavicular ligament is attached on the coracoid process. So the trapezoid part on the superior aspect, trapezoid part of coracoclavicular ligament on the superior aspect, and conoid part of coracoclavicular ligament near the root. The transverse ligament bridges across the suprascapular notch, and converts it into a foramen which transmits the suprascapular nerve, and the suprascapular vessels lie above the ligament. Okay, nerves in the foramen, vessels above the ligament. Spinoglenoid ligament. This is the spine and this is the glenoid. So the spinoglenoid ligament bridge the spinoglenoid notch. The suprascapular vessels and nerve pass deep to it. Dorsal aspect on the lateral border. Here is teres minor, 2 slips. Teres minor arises by 2 slips from the upper 2/3 of the rough strip on the dorsal surface along the lateral border. Circumflex scapular artery lies between the 2 tips. Circumflex scapular artery. The teres major arises from the lower 1/3. Here is the teres major. Teres major arises from the lower 1/3 of the rough strip on the dorsal surface, on the dorsal aspect of the lateral border. Levator scapulae. Levator scapulae is inserted along the dorsal aspect of the medial border. Okay, dorsal aspect, medial border from superior angle to root of the spine. Here is levator scapulae.